my priority as a nurse has always been health and well-being for my patients and for their families and for the communities from which they come. 3 decades I've worked in the nursing profession in all sorts of settings, and watched as I did so our health insurance system deteriorate until there's hardly anything left of it today, leaving more families and businesses behind them with ever-increasing costs and restrictions on care and coverage. My vivid experiences come from working in a school setting as a public health nurse for a school district, where we could clearly separate the students who had coverage, whose parents could pick them up after an accident at school or some symptoms that began to show up, and readily get them into care and make sure they got follow-up. But the vast majority, and increasingly numbers of our, then became our responsibility, where there was no place to go, where a child would come to school. So many times I have such vivid images of a child coming to school, 10, 11, 12 years old, never having been to a dentist, with a huge swelling, not able to eat, not able to concentrate, with real pain. And then searching through all the contacts I had personally, who did I know who would provide the greatest care? The whole realm of vision care, dental or hearing referrals, hoping that you could find generous folks in the community to take one more patient and to make sure that they got the follow-up care. But so many families falling behind. So many children coming to school unable to learn because of the preventable health situations and conditions that could so easily have. And now, thanks to this legislation, those barriers will be removed. And we will have the opportunity to see healthcare delivered the way these wonderful nurses and doctors want it to be, the image and the dream that you have for us. I was privileged to be part of the drafting process, to serve as a liaison between my beloved nursing community and the committees, where we made sure that nursing, the service of healthcare, which nurses provide, will be central to how we reform this legislation. We can't give 47 million more people across this great land enough healthcare, the right kind of healthcare, unless we have the health professionals to deliver it for them. So we need to see that nurses, I'll speak to this population, that those serving in acute care do so with more ratios, more patient numbers that will ensure a better outcome. That we have advanced practice nurses that can provide more primary care services, in many ways in areas and settings more affordable than others have been able to do so. Nurses are at the base of public health education efforts in providing care in community-based settings. I envision a day when we have primary care clinics at work sites, in school, neighborhood school settings, so that families where they feel comfortable can come, not just sending the school kids, but the entire range of services that can provide for the families. I'll just highlight what we can do for nurses and will do for nurses in this legislation. Train more nurses immediately and get them out into the field by expanding education, practice, and retention programs for nurses, enhancing student loan programs, scholarship, loan repayment programs. This works for other providers as well, including doctors, enhancing development of advanced practice nurses, and expanding the existing loan prepayment programs to increase the number of nursing faculty. Also, making sure that we provide the areas of educating the families and communities where they'll be willing and ready to take advantage of the services. We're going to have to be PR people as well as we roll out legislation to many, many people who've never experienced care, as we have such a vivid example of here.